Hi, hello everyone. My name is Lingeshwar. Today I am here to discuss about this introduction of pharmacology. Painkiller, coffee, mosquito repellents, and all these all works because of pharmacology. And pharmacology is not a subject in our daily life. Paracetamol. So paracetamol we are daily using on the reduce of fever. But when it comes to overdose, it can damage to liver, right? And coffee as it keeps awake, but when you drink more coffee daily and it becomes a habit and it leads to addiction and it can causes to anxiety and like that. Same like alcohol. So this alcohol also gives short term pleasure but it leads to liver damage in long term run, right? The same substance which can be due to medicines and which can lead to poison, but here the one thing is the dose, right? That's why pharmacology is very important because it explains us the correct dose, the correct time, the correct combination, and who should not to take the drug and antibiotic awareness. So without pharmacology, medicines becomes dangerous, right? So keep it in mind. So how the pharmacology is important in our daily lives. So let's discuss pharmacology. The simple thing, pharmacons. The Latin term pharmacon means drug and loci, matlab logos means study, right? So what is drug? It is considered as active pharmaceutical ingredient. So this is the two terms as we all know that the medicine and drug. So what's the difference between the medicine and what's the difference between the drug? See, the medicine is a prepared form of a drug. The medicines is prepared form of a drug like tablets, capsules, syrups, emulsions, suspensions, powders, etc. So the drug means active pharmaceutical ingredient. According to WHO, it was a definition like substance or material that is used or intended to be used to modify or explore physiological or pathological states for benefit of the recipient. So for the benefit of the recipient, it can be modified to physiological or pathological states. Like that, it can be the substance used like, and simply we can tell what's the drug means. It is used for prophylaxis, treatment, diagnosis. What is prophylaxis? Like you can say the prevention, not exact term, but you can say the prevention, right? So vaccines. So in our daily life for children, the vaccines are getting like BCG, polio vaccines, and recently we COVID pandemic, COVID-19 vaccines we are all using to prevent. So the drug we can use for prophylaxis of treatment and it is used to treat several diseases like typhoid, dengue, malaria, whatever the diseases we can use the drugs for treatments and for diagnosis. In radiobactive and contrast agents, this drugs can be used like for diagnosis of the treatment through like X-ray, CT scans. For example, barium sulfate, ioxol, diasteroidate, like that we can use, right? This is about drug. And next, the father of modern pharmacology is Oswald Semidiver, and father of chemotherapy, Paul Ehrlich, which we know as magic bullet, and discovery of penicillin. Like from since childhood, we are learning that name, Alexander Fleming, and discovery of streptomycin, Selman Waxman, discovery of insulin, Banting and Bast, and discovery of antimicrobial effect of protosil, which is like Gerhard Damask. So these are all scientist names you can read in books. So I don't want to explain that because I am here to explain the importance of pharmacology, the pharmacology in our daily lives, how it will be going to affect, right? So now we have to discuss about branches. So pharmacokinetics. So pharmacokinetics and pharmacodynamics. Simply the pharmacology is divided into pharmacokinetics and pharmacodynamics, right? So what do you mean by pharmacokinetics and pharmacodynamics? In the name itself, it was having like, see, you can observe pharmaco means as you all know that drug and kinetics means movement. So the movement of drug in our body is deals with pharmacokinetics, and pharmaco means drug, we know that, and dynamics means power. So the power of drug in our body, right? It leads to pharmacodynamics. So simply I will explain what is pharmacokinetics means what the body does to the drug, right? What the body, like how the body does like reflecting to the drug through this absorption, distribution, metabolism, excretion. So absorption through stomach. The drug will be absorbed through stomach and distribute through blood to tissues of the body and metabolized by liver. We all know that first pass metabolism also happens here, and excretion through urine, feces and breast milk. We all that know. This we already know that kinetic means motion, right? So kinetic means movement, and dynamics means power, right? So the drug movement in our body, like what the body does to the drug through these factors: absorption, distribution, metabolism, excretion. Like next, dynamics means drug power, what the drug does to the body through its mechanism of action, pharmacological action, side effects and adverse effects. Briefly we can discuss what is mechanism of action. See, mechanism of action and pharmacological action are both are different. As you are seeing that paracetamol you can take and it inhibits the COX enzyme, cyclooxygenase enzyme, it inhibits. It's the mechanism of action of the paracetamol drug. But when you comes the pharmacological action means it was showing the effect, like what it affects, it reduces fever means antipyretic. So it comes under pharmacological action of that particular drug. But its mechanism of action is particular inhibition of enzymes or inhibition of receptors. Like propranolol inhibits beta blockers, adrenergic, like that. Next, side effects. So it is also different side effects and adverse effects. See, side effects are expected and known. Like paracetamol, when you take, it becomes mild nausea. But when it was coming to adverse effects, this same paracetamol, when you are taking the most like dose or overcome the dose, overdose, PCM overdose leads to liver damage. So it is considered as adverse effects. This is the difference between the main mechanism of action, pharmacological action, and side effects and adverse effects, right? Next, pharmacotherapeutics. So pharmacotherapeutics, you all know that. What is in the name itself? The drug, and therapeutics means treatment, right? Treatment. So it is a study of using drugs to treat, prevent, manage of diseases in patients, whatever. Okay. Next, clinical pharmacology. This clinical pharmacology, in the name itself, the clinical trials, it should be included here because it is a study of drugs in humans, right? It is a study of drugs in humans which includes pharmacokinetics and pharmacodynamics, investigations in a healthy or diseased individual. So in a diseased individual or healthy individual, the clinical trials will be going on. After, we can simply tell what is meant by clinical pharmacology means when the drug is from laboratory, it comes, then it can be used to patient, then the safety they will measure and effectiveness they will measure. All this includes considered as clinical pharmacology, right? In phase 1, phase 2, phase 3, phase 4, later on we will study, right? And toxicology. So in the name itself has toxic effect. So includes study of adverse and toxic effect of drug on body. For example, PCM is prescribed to 500 mg for your, but you are expecting that my fever has high, so I can take up to 1000 mg or 2000 mg like that. Then it will be leads to toxic effect, and the study of that toxic effect is called toxicology, right? Next, chemotherapy. It refers to the treatment of infectious or cancer diseases and which chemical compounds, like chemical compounds are using that kills or inhibits the neoplastic, the cancer cells which are causing the cancers, right? See, the pharmacy is not just a medical shop. As you all know that a pharmacist is a drug safety expert, not a salesman, right? And one wrong tablet can destroy life, one correct medicine can save the lives. And the decision comes from the pharmacology. So if you want to understand beyond the textbooks through this journey, so please subscribe to my channel for more updates and for more support. And pharmacy is not a business, it's our responsibility. And this is Lucky signing off, your pharmacist.